I want to go ahead and just kind of talk about how do we orientate the x-rays to know exactly what teeth I'm actually looking at. Many of our software programs, we can go ahead and select the correct teeth when we take the x-ray, and it will give the number of that tooth. If that doesn't happen, you need to be able to figure out what x-ray you're taking or what tooth you're x-raying. One thing I do recommend is you can always rotate your x-rays when you take an x-ray if it's in the wrong position, but don't ever flip. If you flip the x-ray, then it becomes very difficult to know what side was the original. So always just rotate that. So what you really need to have to know kind of how to orientate it and how to figure out what side of the mouth am I on is go ahead and either have a skull or a model with you that you can go ahead and refer back to. And when you look at the x-ray, it's important to kind of know a little bit about your oral anatomy. But here on this, when we have our maxillary teeth, the maxillary roots are always pointing up. When we look at the maxillary, the crown is pointing down. We want the x-ray in the correct orientation. And then always think about which way is the nose. So here's our second molar, first molar, and our fourth premolar. So we know that the dog's nose is over here. So we are now looking at this dog's upper left, first and second molar and fourth premolar. When you're looking at an x-ray that only has the incisors on it, it might be very difficult to figure out which side is the left, which side is the right. And that's when you kind of need to become one with the sensor and the tube head. So as I have my sensor here, I have my skull ready to go. I know that my sensor is always going to be in the mouth so that the cord is coming out the front. And I have my x-ray tube head coming in at a 45-degree angle. So my sensor is exiting here, my tube head is coming in. So this is my animal's right side, this is my animal's left side. Another way to do that is always just take a little piece of metal, like a paper clip or a periodontal probe, and put it on your sensor before you take the x-ray, but always put it on the same side, and that will show up on your x-rays. Now we've moved on to the mandibular shot. And when we have our mandible set up, we want to go ahead and have our roots pointing down and our crowns pointing up for the correct orientation on the x-ray. And again, we need to figure out which way is the animal's nose. This is his canine. Barely see it. We have our P1, our P2, and our P3. So as you can see here on my mandible, his nose is pointing towards me. That would mean that this is his lower right quadrant.